The CT scan of the abdomen and pelvis is one of the most important diagnostic procedures in modern medical imaging. It provides a detailed view of the internal organs, bones, and blood vessels, helping doctors identify diseases and guide treatment decisions. This is the story of how a CT scan of the abdomen and pelvis is performed, from the preparation of the patient to the operation of the machine and finally to the interpretation of the results. The process begins long before the patient enters the scanning room. When a doctor suspects an internal problem such as abdominal pain, infection, tumor, injury, or swelling, a CT scan is recommended to provide a more accurate picture than a standard X-ray. The patient is given instructions to fast for several hours before the procedure, usually around 4 to 6 hours. This ensures that the stomach and intestines are empty, preventing interference with the images. Sometimes, the patient is asked to drink oral contrast material, which highlights the digestive tract and allows radiologists to clearly see the stomach, intestines, and other abdominal structures. On the day of the scan, the patient is greeted by the radiology technologist, who explains the procedure in detail. Jewelry, metal objects, and belts are removed because they can interfere with the X-ray beams. The patient may be asked to change into a hospital gown for comfort and accuracy. If contrast material is to be used, an intravenous line is inserted into a vein in the arm. This IV contrast, usually iodine-based, helps to make blood vessels, organs, and tissues stand out more clearly in the images. The technologist checks for any allergies or previous reactions to contrast agents to ensure safety. Now the patient is ready for scanning. The CT scan room is dominated by the large donut-shaped machine, known as the CT scanner. It consists of a circular opening with a motorized table that moves the patient slowly through it. Inside the circular gantry, an X-ray tube rotates rapidly around the patient while detectors on the opposite side capture the X-rays that pass through the body. These signals are sent to a computer, which processes them to create cross-sectional images, known as slices. Each slice represents a thin section of the body, and when combined together, they form a three-dimensional view of the abdomen and pelvis. The patient is asked to lie flat on the table, usually on their back, with arms raised above the head to avoid shadowing the abdominal region. The technologist may use straps or cushions to help the patient remain still during the scan. Once the positioning is correct, the technologist leaves the room and operates the machine from the control area behind a lead glass window. Through an intercom, the technologist maintains communication, providing clear instructions such as when to hold the breath and when to relax. The scanning begins with a quick overview, often called a scout image, which helps determine the range of the area to be scanned. Then, the main scan starts. As the table moves slowly through the gantry, the X-ray tube spins continuously around the patient. The process is usually painless, but the patient may feel a warm sensation or a metallic taste in the mouth when the IV contrast is injected. This is normal and fades within seconds. Modern CT scanners use advanced technology such as multi-slice or helical scanning, which allows rapid data collection and high-resolution imaging. In just a few seconds, hundreds of slices are obtained, capturing fine details of organs like the liver, kidneys, pancreas, spleen, intestines, urinary bladder, and reproductive organs. The system uses sophisticated algorithms to reconstruct these images and display them on the workstation monitor. Once the scan is completed, the technologist checks the images for clarity and completeness. If everything looks good, the patient's IV line is removed, and they are asked to wait for a few minutes to ensure there are no side effects from the contrast. The entire procedure usually takes around 15 to 30 minutes. The patient can resume normal activities shortly afterward unless otherwise advised by the doctor. Now the focus shifts to the analysis of the images. The radiologist, a doctor specially trained in interpreting medical scans, reviews the images on a high-resolution computer screen. Using specialized software, the radiologist can adjust brightness, contrast, and zoom into any area of interest. They can view the body in multiple planes, axial, coronal, and sagittal, allowing for a complete three-dimensional understanding. This flexibility is crucial in detecting small abnormalities that might be missed in traditional imaging. Each organ and structure is carefully examined. The liver is checked for masses, cysts, or signs of fatty change. The kidneys are inspected for stones, infections, or tumors. The intestines are reviewed for obstruction, inflammation, or perforation. The urinary bladder and prostate or uterus are evaluated for any irregularities. The surrounding fat planes, lymph nodes, and blood vessels are also observed to identify infections, abscesses, or vascular abnormalities. In trauma cases, the radiologist looks for internal bleeding, fractures, or organ injury. Advanced analysis tools may include contrast enhancement studies, where the radiologist compares images taken before and after contrast injection to study the flow of blood through organs. This helps detect tumors or blockages. The radiologist can also generate three-dimensional reconstructions of blood vessels or bones, providing surgeons with detailed maps before operations. After the analysis, the radiologist prepares a comprehensive report describing the findings. This report includes details about the organs, any abnormalities detected, and the likely causes. It may also include recommendations for further imaging, biopsy, or specialist referral. The report is then sent to the referring physician, who discusses the results with the patient and plans the next steps for treatment or management. Behind the scenes, the CT machine's computer system stores all the data digitally in the hospital's imaging archive. This allows doctors to review previous scans and compare them with new ones to track disease progression or response to treatment. The technology used in CT scanning continues to evolve, with newer machines offering faster scans, lower radiation doses, and sharper images. Artificial intelligence is now being introduced to assist radiologists in detecting subtle abnormalities and automating parts of the analysis process, making diagnosis faster and more accurate. Although CT scanning involves exposure to X-rays, the benefits usually outweigh the risks, especially when it helps detect serious conditions early. Safety protocols are strictly followed to minimize radiation, especially in children and pregnant women. Contrast agents are also used carefully to prevent allergic reactions or kidney problems. The CT scan of the abdomen and pelvis has become a cornerstone of modern medical diagnosis. It reveals hidden details of the body with precision and speed, providing life-saving information for doctors and patients alike. From the moment the patient lies on the table to the final report, every step of the process reflects